G'day, my name's Aaron Hollins. I'm a GP and medical educator and senior lecturer with JCU. Clinically, I work at Dumaji for Gidgee Healing, and I also work here in Atherton for GMT and JCU. So look, I got interested in public health when I was a junior doctor, and I've worked in places like Dumaji and Mornington Island, and I realised that we needed to have a broader look at what's happening with people's health. So once I completed my GP training, I went on to undertake public health training as well, which I've recently completed. With my public health training, I worked for the Queensland Aboriginal and Islander Health Council, as well as the Public Health Unit in Cairns. This advanced skills training in population health is ideally suited to registrars who want to stay in their rural and remote town, want to have a look at their community from a broader perspective, and also might have an interest in public health and further qualifications in public health. So you can do advanced skills training in population health with ACRM, and they have a well-recognised curriculum to do that. For registrars enrolled with RACGP, we need to contact the rural centre and get permission from them to undertake advanced training in population health. This advanced skills training in population health takes 12 months to complete. You can take a bit longer, particularly because there are some requirements to do an epidemiology course as part of that advanced training. So registrars need to talk to their medical educator in their local node and apply through the GMT placement process to do advanced skills training in population health. They also then need to apply to their respective college. So the assessment for advanced skill training in population health is mainly around a project that you need to complete. So that project is almost like a research project, but it can also be a health promotion project, it can be a community needs analysis or an audit of practice. The other assessment that you need to do as part of this formative and summative supervisor feedback, and you also need to complete an epidemiology course at a... Having done an advanced skill post in population health gives you really transferable skills, so you can work in any setting that you like in rural and remote Australia. It's given you the skills to have a big picture look at what you're doing as part of your practice. So keeping your skills current may involve completion of a Masters in Public Health or equivalent, but you can also do CPD through your respective colleges that do concentrate on population health. So whilst you undertake an advanced skill training in population health, you're still working clinically. This AST does allow you to take a step back and have a look at that bigger picture. So you have an academic supervisor who has specialist qualifications in public health or a master's degree in public health, as well as a clinical supervisor who has qualifications in rural health. So I undertook additional training in public health because I have a passion for the bigger picture, I guess. So I felt by undertaking public health training, I could make a bigger difference on a bigger scale. So registrars who do advanced training in population health, they have broader skills than just what the AST provides them. They can do research, they can be very competent at auditing their practice. They will also be able to look at their community quite broadly and take that with them wherever they go. Doing advanced training in population health really equips you wherever you go to work, because it gives you those skills where you look at that big picture and look at what the community needs. One of the registrars who's done advanced training in population health went on to work for the World Health Organization in Geneva. So that's the sort of thing that you can look at if you undertake this training.